Well, thank you so much for walking me out after our quality committee meeting. Now that I've been on the board for 6 months, I'm really starting to understand the flow of our work and the terminology.
Oh, that's great. We know it takes time for new board members to get up to speed.
I don't know if you knew this, but I'm a breast cancer survivor.
I did not. Is that a reason you decided to join us?
Yes, after being a patient, you really start to see healthcare differently. I just want to make sure other patients are getting good care. I was lucky to be diagnosed when I was in stage 2. What gave me the most anxiety was not knowing if the treatment I was getting was the right treatment for me. There were so many ifs and thens. That's why your discussion on diagnosis and effective care really hit home today.
Well, I think any patient that walks through our doors wonders the same thing. Will I get the most effective care? Will it lead to the best possible outcome? We work really hard to select staff that are competent and capable, and we compare our performance on common conditions across our systems and through national databases of outcomes for those conditions.
What outcomes are you evaluating?
Well, for example, we recently looked at emergency room metrics across our 7 hospitals and found 2 were substantially better at diagnosing appendicitis. We also looked at outcomes in our behavioral health clinics and found 1 clinic had lower rates of depression for teens in our treatment. So we've asked these teams to share their processes and teach others in our system what they're doing to achieve their results.
I think it's really great that you're evaluating outcomes, and even better that you're sharing the results across the system. I think all of us on the board would like to hear more about that.
We'll share a more in-depth outcomes analysis at the annual Board Quality Committee retreat.
Oh, that's great. You know, when I was going through chemo, I had a lot of family to support me. But I often wonder how patients who don't have someone to drive them to their appointments did. If their insurance wasn't as comprehensive as mine, if English wasn't their first language, would their outcomes be the same as mine?
Exactly. So we're now starting to look at outcomes based on things like race, ethnicity, socioeconomic status in a more intentional way. Collectively, those are called social determinants of health, and they're big drivers of outcomes.
It really makes sense to consider things like that. I mean, what if a patient can't afford their prescriptions or the tests themselves? How does our system help people of lesser means achieve good outcomes?
Denise, I'd like to introduce you to one of our newer board members. Julia Nyholm is a VP at Jones Real Estate Development, and she's had a hand in building some of the skyscrapers you see around us. Julia, Denise is our Director of Social Work, and you just asked a few questions that really fall under her area of expertise.
It's nice to meet you.
Welcome. It's good to meet you too. It's timely that I ran into you, Jeff. I've had 3 social workers reach out from our community clinics. It seems we're doing an excellent job when it comes to hypertension education in our clinics, but our patients are still struggling to afford their medications.
This is a great example of what Julia and I were just discussing, how important it is that the pieces of our patients' health care, the medication, the treatment plans, affordability, transportation to and from follow-up treatments all fits their needs. What can we do to help you?
Well, we're working on a strategy to address this issue, and I'd like the opportunity to present what we found to the management team. If we can work with our clinicians to prescribe the most cost and clinically effective medications for hypertension, for example, then our clinic pharmacies can stock fewer medications in larger quantities, and we can offer prescriptions at a lower rate. Maybe even consider generics when it's appropriate.
Well, we'll get you on the calendar as soon as possible. Thank you for tracking this, and please, let me know if there's anything else you need.
You know I will, and thank you. It was nice to meet you, Julia.
Likewise, thank you for your work. It really sounds like she's on top of what your community needs. And it's really good to hear firsthand how we're working as partners across the system.
Well, delivering quality across a large health system takes teamwork for certain. Is there anything else I can clarify from the quality committee meeting today?
It's more feedback at the moment. When we talked about credentials, you presented a situation where a provider was disrespectful to peers. And I was really impressed with how the chair requested further follow-up and support for the individual whose anger issues were a problem before approving credentials.
Our clinicians and staff don't just have to be capable and current in their practice. They have to treat patients and colleagues with respect, especially because teamwork, a respectful work environment, and a healthy culture have all been linked to better patient care.
I'm beginning to see how physician wellness impacts patients. When you shared metrics and work around employee engagement and burnout, it was eye-opening. I was really shocked and saddened to see that there was so much violence towards healthcare providers by patients. Hearing their stories really helped me understand the metrics on our dashboard.
There are many factors influencing violence against staff, and we really need a multi-factored strategy to manage it.
Well, we really did pack a lot into today's meeting. And you really are doing God's work to make sure patients are getting the right care and that the care teams are treating them and each other with respect.
Yeah, it's not always easy, but it is such a gift to be able to help people in their time of need. Here. Quality is providing the right care for patients